Everybody. My name is Bracy Wood, and this is my senior project for the year 2015. The title is 17 Minutes of Hope. I chose this project because I've lost a lot of family and friends to suicide and have experienced depression myself, and felt like a lot of people need to be aware of some of the symptoms and warning signs and everything else that needs to be dealt with these situations. So, suicide prevention. For young people ages 15 to 24, suicide is the third leading cause of death, and at least 2,000 adolescents 15 to 19 commit suicide each year. And the increase in the rates of youth suicides over the past 4 decades is largely related to the use of firearms as a method of destruction. People under age 25 accounted for 15% of all suicides in 1997. Within schools, this statistic translates to, in a district of about 8,000 students, one suicide per year. Firearms are the most common method for completed suicides, followed by ingestions leading to overdose and hanging. 65% of completed suicides use handguns. And substance abuse and dependence is the probable reason that adolescents' attempts are more lethal. There are 400 suicide attempts by teenage males for every completed suicide, and about 4,000 suicide attempts per every death in females. Approximately 20% of students have had suicidal ideation. 10% have made a suicide attempt in a 12-month period. 1 to 3% of teenagers will receive medical attention for an attempt. About 0.01% will be successful. Ideation is almost always episodic. Episodic is containing or consisting of a series of loosely connected parts or events. There are many warning signs of suicide. You need to seek immediate help from mental health or an emergency provider for each of the following: threatening to hurt or kill themselves, looking for ways to kill themselves, seeking access to pills, weapons, anything like that, talking or writing about death, dying, or suicide, when these actions are out of the ordinary for this individual. And you need to seek immediate help from mental health or call 1-800-273-TALK 8255 if the following occurs: you feel helpless, you have rage, anger, seeking revenge, your recklessness or risky behavior, expressions of feeling trapped, increased alcohol or drug use, withdrawal from friends, family, or society, anxiety, agitation, inability to sleep or constant sleep, dramatic mood changes, and no reason for living, no sense of purpose in life. Profile of children with completed suicides. Immature problem solving that translates into more impulsive behavior, less able to tolerate frustration, unable to plan future actions, aggressive or violent outbursts, difficulty making decisions, and less able to assess situations realistically than non-suicidal children. A loss of a parent before the age of 12, history of parental abuse, early onset of suicidal behavior, pre-pubertal, predicts suicide behavior in adolescents. More than 90% of subjects who committed suicide met criteria for at least one major psychotic diagnosis. Half of these subjects had a psychiatric disorder for at least 2 years. And 1 in 4 adolescents that completed suicides showed evidence of planning. The important implications need for thorough diagnostic review. Never discount a threat, especially in context of an affective or substance abuse disorders. Importance of aggressive intervention in first episode affective illness. If a friend starts to make suicidal threats, don't take this as a joke. Get help. The most common diagnostic groups for mood disorders: 52% major depression, disruptive disorders, and substance abuse. A child with a mood disorder is 4 to 5 times more likely to attempt suicide than a child without a mood disorder. A completer is a person who was successful on their attempt on their life. 60% of completers used firearms. 50% of completers were never in therapy, and 75% of completers communicated thoughts about their suicide out loud to several people months before dying. Strategies for preventing suicide: suicide awareness programs, screening, and first step of recognition. What to do: talk, tell. They will tell you if something's wrong, but not flat out. You ask. If you think they're suicidal, ask them directly. Don't beat around the bush. And you'll need to listen. Listen to them. Don't try to convince them they need to live. Sometimes just having someone to talk to and listen helps them understand that it's really not that bad and they don't need to die. And keep safe. Find them a person who they can connect with. It is important to find someone to help. Understanding depression. What causes depression? Family history. Having a family member or members who's had depression may increase a person's risk. Imbalances of certain chemicals in the brain may lead to depression. Monoamine oxidase, MAOA, that is an enzyme that breaks down chemicals like serotonin, morphine, and dopamine. It's a lot higher in those with untreated depression. Major life changes. Positive or negative events can trigger depression, like a death of a loved one, a heart attack, stroke, or cancer, are the major illnesses that can trigger major depression. Certain medications used alone or in combination can cause side effects much like the symptoms of depression. Use of alcohol or other drugs can lead to or worsen depression. Depression can also occur for no apparent reason. Symptoms of depression vary from person to person, and there are 2 key signs: loss of interest in things you like to do, and sadness or irritability. Additional signs include changes in feelings, which may be feeling empty, inability to enjoy anything, hopelessness, loss of sexual desire, loss of warm feelings for family or friends, feeling of self-blame or guilt, loss of self-esteem, inexplicable crying spells, sadness or irritability. Changes in behavior and attitude. They may include general slowing down, neglect of responsibilities and appearance, poor memory, inability to concentrate, suicidal thoughts, feelings or behaviors, and difficulty making decisions. Physical complaints may include sleep disturbances such as early morning waking, sleeping too much, or insomnia, lack of energy, loss of appetite, weight loss or gain, unexplained headaches or backaches, stomach aches, indigestion, or changes in bowel habits. Common types of depression are major depression, dyssymptomia, bipolar disorder, and seasonal affective disorder, or SAD. Major depression causes symptoms that may begin suddenly, possibly triggered by loss, crisis, or change, interfere with normal functioning, continue for months or years. It's possible for a person to have one episode of major depression, but it is more common to have 4. It is more common if episodes to be long-lasting or to occur several times during a person's life. by Cynthia. People with this illness are mildly depressed for years, and they function fairly well on a daily basis, but the relationships suffer over time. Bipolar disorder. People with this type of illness change back and forth between periods of depression and periods of mania, an extreme high. Symptoms of mania may include less need for sleep, overconfidence, racing thoughts, reckless behavior, increased energy, mood changes that are usually gradual but can be sudden. Season affective disorder, or SAD. This is a depression that results from changes in the season. Most cases begin in the fall or winter, or when there is a decrease in sunlight. Professional treatment is necessary for all these types of depression. Treatment for depression. Medication. Antidepressants can help ease the symptoms of depression and return a person to normal functioning. Antidepressants are not habit forming. Psychotherapy. This can help many depressed people understand themselves and cope for their problems. For example, intrapersonal therapy, which is therapy that works to change relationships that affects depression. And cognitive behavioral therapy, which helps people change negative thinking and behavioral patterns. If you or someone you know has symptoms of depression, take action now. You need to see a doctor for a complete checkup. Go to the counseling center and talk to a counselor. Talk things over with a friend, family member, or a residential life staff member. Don't expect too much of yourself. Take a break, get some exercise, and avoid extra stress and big changes. Things you should do. Reduce or eliminate the use of alcohol or drugs. Exercise or engage in some form of physical activity. Eat a proper, well-balanced diet. Obtain an adequate amount of sleep. Seek emotional support from family and friends. Focus on positive aspects of your life. Pace yourself, modify your schedule, and set realistic goals. Things to avoid. Don't make long-term commitments or important decisions unless necessary. So don't try to stress yourself out. Try to take things in stride. Don't assume things are hopeless. Don't engage in emotional reasoning, like, because I feel awful, my life is terrible. Don't assume responsibility for events which are outside of your control. Don't avoid treatment as a way of coping. To intervene with a depressed friend, be empathetic and understanding. Don't try to cheer up a depressed person. Avoid critical or shaming statements. Challenge expressions of hopelessness. Empathize with feelings of sadness, grief, anger, and frustration. Helping a depressed friend. Don't argue about how bad things are. Don't insist that depression or sadness are wrong feelings that to be experienced. Don't become angry even though your life's efforts may be resisted or rejected. Advocate for the recovery from depression. Emphasize that depression is treatable. Seek consultation. Encourage them to seek help. Go with them to the counseling center. Be supportive of counselor or doctor suggestions. I'd like to thank everybody for listening to my presentation and watching. Please get your friends help. They need it.